Welcome to one-on-one fitness training with Jamie, Cameron, Maurice, and Nassir. One of the three aspects we're going to be focusing on today is cardiovascular health. For cardiovascular fitness, a walk on a treadmill is a great starting point. Warm up the muscles and joints sufficiently so the rest of the workout can progress smoothly. Monitor your client to see if there's any discomfort in the hip and knee joint. Many older adults have hip and knee pain, often due to weight gain, lack of activity, and/or lack of flexibility. This can be perceived as injury, so start your client out with a low-level aerobic warm-up to warm up the hips. The next aspect is strength training. Muscle strength declines significantly after age 50, at approximately 15% per decade. Weight training should be done with light weights, using a level that is comfortable for the client to lift at the start of training and increase repetition as the muscles get stronger. The final aspect is flexibility. Focusing on improving day-to-day function in older adults reduces healthcare, provides independency, and allows for a better quality of life.
Alright, this first exercise you're going to be doing is the wall push-up. What you want to do is stand about 3 feet away from the wall, shoulder width apart facing the wall. You're going to extend your arms onto the wall, lean forward and place your hands flat. All you're going to be doing is push-ups. Basically what this does is it helps increase the strength in your chest and shoulders. You're going to do this for about 10 reps. Other than a regular push-up, what this does is it takes your body weight off of it. For someone who could be about 65 or older, this helps them be able to still have upper body strength without using all their body weight. The next exercise you'll be walking your client through will be the knee extension exercise. This will help strengthen your knees, which will improve your balance and reduce risk of falling. Strengthening your knees will also allow you to walk and climb stairs with greater ease and comfort. So first, you want to take any chair that you can find. You sit on the chair with your back straight, knees bent. Slowly extend your right leg in front of you. Hold for a few seconds before lowering it back to the starting position. Repeat with your left leg. We'll have to do 10 repetitions each leg, so 20 total. For a more advanced version, you can also strap an ankle weight around your ankle. Aim for the weight that is heavy enough for where you cannot do more than 15 repetitions per leg. As you get stronger, you can add more weight to keep it.
For the bicep curl, make sure you're using a weight that is appropriate for your current level of strength. If you're just starting out, a 5-pound dumbbell in each hand may be appropriate. You want the weight to be heavy enough that by the time you complete 10 to 12 reps, you feel like you can't keep going. First, you want to sit with good posture in the chair. Remember to engage your core by imagining your sternum moving back towards your spine to stabilize your posture. One dumbbell in each hand, palms facing forward, shoulders relaxed, and elbows close to your body. Focusing on your bicep muscle, bend your arm at the elbows and lift the weights about 3/4 of the way towards your shoulders. Avoid rotating your shoulders forward and keep your elbows fixed at your side. Breathe out as you lift the weight and breathe in as you lower them. And for this segment, we want to do about 10 to 12 repetitions.
See how he's doing, he's making sure he's not overextending his elbow. Okay, the next upper body exercise we're going to do is the tricep curl. While the bicep curl above strengthens the muscle in the front of your arm, the tricep exercise focuses on the back side of your upper arm. The area tends to get flabby with age and lack of use. If either of these exercises hurt your elbows, then don't do them. As the tricep tends to be weaker than the biceps, you may want to use lighter weight. To start, maybe as light as 2 pounds instead of 5. For the first tricep exercise, you want to sit with good posture in the chair, holding the dumbbell in your right hand. Raise the dumbbell above your head and stabilize your right arm by placing your left hand on your right elbow. Slowly bend your right elbow, lowering the dumbbell behind your head. From that starting position, raise the weight toward the ceiling and then gently lower it back down behind your head. Repeat 10 times and then switch arms. This next exercise we're going to do is a two-shoulder exercise. This exercise will help strengthen your shoulders. By strengthening your shoulders, you will improve your ability to perform most of the arm movements, whether it's to pass a bowl of food across the table or lift a suitcase. It can also relieve shoulder pain. Following are two examples of exercises that target your shoulders. To perform an overhead dumbbell press, you want to have your client sit with good posture, one dumbbell in each hand, with your elbows bent so that the dumbbells are up by your shoulders, palms facing forward. From this starting position, press the dumbbells toward the ceiling, and then lower back down to shoulder height. Breathe out as you raise the weights, and in as you lower them. Repeat 10 to 12 times.
For our next exercise, we're going to have our client perform the sit-backs. Sit-backs will strengthen your core muscles, which will allow you greater mobility for everyday tasks, such as getting out of bed or rising from a chair. This exercise will be done on the floor. You may want to yoga mat if you don't have a rug. First, you'll begin sitting on the floor with knees bent and your arms crossed in front of your chest, as if you're giving yourself a hug. Slowly sit back as far as comfortable. This doesn't have to be a very big movement. The key is to remember to engage your core and avoid rounding your back. It can be helpful to have someone sitting by your feet to prevent your feet from lifting off the floor. You're going to repeat this 10 times.
Squatting exercises increase hip flexibility and strengthen your hip flexors and quadriceps, which will improve both your walking ability and your ability to stand up from a seated position. It also improves your overall balance and stability, reducing your risk of falling. For the beginner's version, stand up using a chair for support and perform a standing partial squat as demonstrated. Remember to push your buttocks out as you bend and maintain a straight back posture, and do not bend your knees past your toes. Once you're comfortable with that, try doing a half squat against the wall. This can be a more challenging move, especially if you get all the way into a seated position. For step number 1, stand with your back leaning lightly against the wall, with the legs slightly wider than shoulder width apart. Step number 2, bend your knees, sliding your buttocks down the wall. Keep your kneecap in line with the middle toe of your foot and do not bend your knee past your toes. Step number 3, if your strength allows, place your feet a bit further out from the wall and lower yourself down to a seated position as if you're sitting on an invisible chair. Hold this position for a few seconds before raising yourself back up. Step number 4 is to repeat step number 3 10 to 20 times.
The next exercise we're going to do is toe taps. This helps keep blood circulating in your legs. It also strengthens your lower leg. What you're going to do is first you're going to sit in a chair, keeping your heels on the floor. Lift your toes as high as you can so you can feel the muscles along your shin working. You're going to repeat this 20 times.
Our next exercise is going to be focused on strengthening the upper calves. Sitting in a chair, you're going to have your client keep their toes and the balls of their feet on the floor and lift your heels. We're going to do this 20 times.
Now moving into our balance segment. Our first exercise we're going to do with our client is a single leg balance. You're going to want to stand with your feet hip width apart, hands on the hips, or on the back of a sturdy chair if you need support. Lift your left foot off the floor, bending at the knee, and lifting your heel halfway between the floor and your buttocks. Hold for 10 seconds. Eventually working up to 30 seconds, return to the starting position and repeat with the opposite leg. We're going to want to repeat this exercise 3 times per leg.